Vitaly Djuma. As said, I am Executive Director of Eurasian Coalition on Mental Health ECOM, based in Estonia, but we are a regional association of LGBTI organizations and allies and activists working on HIV among gay men and other MSM and transgender people in Eastern Europe and Central Asia. So I myself am an individual member of IAS for, I think, for more than 13 years maybe. So, but I would like to thank organizers, IAS, but also local organizers of this symposium for the opportunity to present. In my hopefully short presentation, I will focus on the issues of addressing stigma against gay men and other MSM in our region. In the morning, we heard from the presentation of UNAIDS, and you, based here, perfectly know the situation of HIV prevalence among gay men here in this country. It's the highest in the region, 20% in the country and 25% in capital city. 25% of gay men and other MSM live with HIV. But this situation is similar throughout the region. Similarly high prevalence rates we have in other countries, in Romania, in Montenegro, in major cities around the region, in Kiev, in St. Petersburg, but also in other countries. So more than half of the countries of the region register concentrated epidemic, HIV epidemic among MSM, meaning that the prevalence level is above 5%. Why is it so? So we have to come back to the basics of the epidemic. So risk for HIV infection for MSM are, as we know, categorized in three categories: individual level risk, sexual behavior, network level risk, for example, chemsex or sexual practices, meaning chemsex or using stimulants in sexual activities. High prevalence of sexually transmitted infections in gay communities in the region. But in my presentation, I will focus on the third category of risks, social and structural risks. One of them being low access to services and stigma and discrimination. So we have to bring the discourse to the question of low access to services being one of the major risks of infection. It's not just a situation that we live in. We don't have funds, okay, so the access to services is limited. Per se, again, the low access to services increases the risk for infection for MSM and other key populations. And of course, as in many other key populations in the region, stigma and discrimination are arguably the major risks for infection in our groups. So what about the access to services? ECOM has conducted a study of treatment cascades for MSM in 5 countries in the region. We developed a small, easy-to-use tool, and we provided technical assistance. We trained our national partners. So ECOM and our national community-based organizations have conducted research on treatment cascade, and unfortunately, the results are very pessimistic. Only in Armenia, we have a relatively high level of the first 90, right? So these figures show the first column is the estimated number of people, MSM, gay men and other MSM living with HIV. The second column shows the number of MSM living with HIV who know about their status. The second column shows the MSM who live with HIV and receive antiretroviral treatment. And the third, finally, is the column for viral suppression. So as we see, only in Armenia, the results of the HIV treatment cascade are relatively good. because it is a country of not developed HIV epidemic among MSM. It's estimated number of MSM, gay men and MSM living with HIV is slightly above 100, so it's quite easy to reach. But in all other countries that we were able, with our national partners, to assess, the situation is quite dire, with Belarus having less than 10% of MSM living with HIV who know the status. As for Georgia, our national partners, Equality Movement, has conducted their own study on treatment, and the figures are also not very optimistic. It's about 17 to 18% of estimated number of gay men and other MSM who live with HIV, who know their status, who know their HIV status. 17 to 18, depending on what basis we take for the estimated number of MSM living with HIV. So why is it so? We see that there are major gaps in 1990 on the first stage. So gay men and other MSM who live with HIV don't know the status, meaning the substantial number of MSM with HIV do not have access, do not use antiretroviral treatment, even in the situation where the country or the region declared universal access to ARV. So reason is low coverage of prevention and especially testing, as already mentioned here. Existing prevention program do not match the needs of the communities, and low use of services. Then coming to the issue of low use of services, we clearly see that stigma in discrimination is a major barrier to the use of services. ECOM also conducted a regional study in the same 5 countries on gatekeepers' attitude towards LGBT, and with gatekeepers we mean healthcare workers, social workers, and police officers. The results were quite expected in a way that we see that, for example, healthcare, on the question if you personally know someone who is LGBT, most healthcare and social workers responded positively, while police workers do not know someone who is openly lesbian, gay, bisexual, transgender. Then on the question of your personal attitude towards homosexuality, which of the statements is closest to your opinion? So homosexuality should be accepted, homosexuality should not be accepted, or neither of the 2 statements. Most of healthcare and social workers responded positively that homosexuality should be accepted in the society, while the police answered that homosexuality should not be. While per se these answers are not really optimistic, but the answer to the next question is really important that we should keep in mind when working with our gatekeepers. On the question whether LGBT people should enjoy the same rights as other members of society, obviously, but as expected, healthcare and social workers predominantly say yes, but also the police workers. If we look at the answer options, completely agree, or rather agree with the question, with the statement that LGBT people should enjoy the same rights, 47% or 48% of police workers, so close to half of all police workers, agree with the statement that LGBT people should enjoy the same rights, which gives us the food for thought and food for action to work with our gatekeepers. So conclusions, obviously, police is most negative, but gatekeepers are more tolerant if they personally know someone who is LGBT. On the stigma, not only influences from the outside, as we already, I think, saw in one of the presentation, but the stigma also influences our behavior from the inside. So ICOM has conducted also a regional study on internalized homophobia and access to services. Ooh, okay, 3 minutes. Okay. So it was quite a big survey of 8,000 respondents throughout the region. In the survey, in the study, we used the hypothesis that the bigger the stigma in the society, the bigger the stigma is self-stigma or internalized homophobia within the community, and the bigger the internalized homonegativity is, the less is access to services. And the results of the study have confirmed our hypothesis. So as we can see, so people who are more acceptant or who accept their own homosexuality are more likely to use services, HIV and health-related services. And these are associations significant, even controlling for other variables. So what should be done? These at least 3 researchers that we have done have confirmed our strategy, our advocacy strategy. So we have to work on the participation, on increasing participation of MSM community in national decision making. It's not enough that communities participate only in the design of the program or delivery of the program. They have to be involved on the top stages. So we have to strengthen strategic information. All this data that we already know is important to make for our decision making to make informed decisions. Sorry for this tautology. So of course there is scientific evidence to work on combating stigma and discrimination and creating legal environment. So what we do in ICOM and what our national partners do is we work on legal literacy trainings for community activists. We monitor human rights violation. We work on increasing outreach on stigma and discrimination with public officials. As I mentioned, we document human rights violation. And finally, in terms of strategic information, we develop very useful epidemiological briefs. At least this is not one of it's just one part of the work that we do on strategic information. But this is one that I wanted to mention, that we develop epidemiological briefs practically on each country or the region, including now on Turkmenistan. So, but especially in Georgia, we have it now in, obviously in English, but also it is translated in Georgian, and our expert Sergo has prepared this brief. We also have similar briefs on other countries of South Caucasus. So I hope and I'm sure that those are important steps to combat stigma in the general, but also to increase the level of HIV response among gay men and other MSM in the region. Thank you so much.